Hello everyone, I'm Dr. Rich Castellano, the Smile Doctor. Hopefully you got some sleep overnight and now you are heading into your day after follow-up facelift appointment where your wrap is going to be changed. As always, please make your medical decisions with your doctor. For the 24-hour follow-up appointment, here is what you need to know. I like to start out by asking my patients, how did you sleep? If you did sleep, great. If you didn't sleep, you will. Trust me on this. The body takes what it needs. As I said before, I like to ask your pain score 0 to 10. 0 if no pain, 10 is that's the most. This number is helpful to communicate to your doctor and your caregiver so they know if you're taking enough medicine. Patients usually take the pain pills for a few days. Some take only Tylenol. Some take all of their pain medicine. It's very important to be writing down which medications you're taking and when and how much so you don't miss or delay doses unnecessarily. I like to check on fluid intake because it's easy to get dehydrated during the recovery. We just forget to drink. The next step in the 24-hour appointment is taking the wrap off, which usually feels very good. So what are we looking for? Now, do you know how when you go to sleep on the bed sheets and you see little crinkles in the skin on your face? You will see this when the wrap comes off. It's totally normal and it'll go away. Now, you will also see swelling around the ears and the sides of the neck. You may see some bruising. Some patients feel like they look like a football player. This swelling will also go away. I am looking for small little fluid collections that are easily drained with a little needle. These are uncommon and they're easily treatable. Usually this is not necessary, and if we do drain fluid, most patients don't feel anything because the skin is numb. We will clean up the skin. I like to use Hibiclens, which can be found over the counter in most pharmacies. I've gotten away from using peroxide for wound care because it can be harsh and abrasive on the wound. If you do use peroxide, please use it sparingly and don't use much, if any, directly on the wound because it irritates the wound. After the Hibiclens, I like to use Vaseline and a lot of it. Remember, moist wounds heal the best. For the day after, I put on a similar wrap like we did the first time. We put that on for our patients, and I tell my patients you don't have to do this at home. Then I instruct patients that on the second day after their wrap, when they go back home, they can take the wrap off, hop into the shower, get their hair wet, wash, don't soak, but get wet. Use soap and water. You can towel dry, and then we use the Hibiclens, the Vaseline again, and at home, patients just need to put some gauze around their ears, under the chin, and 2 brown ACE wraps. The goal is to hold pressure on the wound, prevent fluid buildup, and if the wrap starts to irritate the skin, like I said before, I recommend stopping the wrap altogether. Ideally, we like our patients to wear the wrap around the clock, 4 days around the clock, and then 3 more nights, so a total of 7 nights. Some of my patients, they love that wrap and they wear it as much as possible, and some want to be done with the wrap as soon as they can. In the next video, we continue with wound care, what to look out for as you recover, activity recommendations, and follow-up routine. We'll see you in the next video.